or make some type of tray, custom tray, whether it's a bleaching tray or a like Invisalign too, that you can do that as well too. Those impressions to do that as well. There's really, when it comes down to it, there's about really just 3 different types of impression materials out there that you're going to run into. The first one is a product that's called an alginate type product. Everybody's familiar with what an alginate is? Okay. It's essentially it's a powder liquid material. It's a powder material in a bag. You scoop it and then you just add water to it and mix it. The nice thing about alginates is they are relatively inexpensive. You got a powder, you just mix it as you use it. The disadvantages to it is that they're not very accurate. So they're good for temporization. You guys won't be using those here today. You use what we call, what are those called, Dr. Estes? The little,
the little buttons. I don't know.
It's okay. Yeah, it's like a little rubbery button type thing you put on there. So they're kind of nice because they're just little unidos things. But alginates are good for one pores, meaning that you fill up your tray, you take an impression, and then whatever you're going to do with it, you do it immediately. Because what happens with an alginate over time is they have a tendency to attract moisture. So everybody know what the difference is between hydrophobic and hydrophilic is? Okay, so what does phobic mean? Scared of, right. So hydrophobic is scared of water, right. So materials that don't like water, what's a material that we've learned about that doesn't like water? Something you do when you're doing like a cavity prep.
With the liners.
Composite.
Glass liners love water, so those
Resin.
are hydrophilic.
Resin.
Okay, so philic and phobic. That's the two for that one. Hydrophilic means likes water. Hydrophobic doesn't like water. So if you just remember the one phobic, the opposite's like, right? Okay, so there you go. So hydrophobic means that it's not going to attract moisture. It doesn't like. So typically our restorations, like our composites, our resins, they don't like water. Hydrophobic or hydrophilic materials attract moisture. They like moisture, so they'll pull in. That can be a good thing and a bad thing. In the case of amalgams, or sorry, alginates, is that they have a tendency to attract too much moisture, so they become inaccurate. So you pour them up, you make them, you take the impression, you're good for one use, and then that's it. After a while, they start to absorb moisture from the air and they distort, and you're done with it. Okay? But they're relatively inexpensive. The next product that came out after that was a product called polyethers. Polyethers came out probably in the 80s, and it's a great material for taking accurate impressions. They're pretty much idiot-proof. You go in, if there's blood, saliva, whatever, if that prep looks horrible, and everybody knows how I talk about prep. Like the actual little nub that the doctor preps to put the crown on. Okay, we're going to take an accurate impression of that. There's always blood, there's always saliva, there's always moisture in there. So we're always fighting that. We're trying to make sure that that's dry. Well, polyethers are great because they're hydrophilic. They like moisture. So when you take the impression with them, you get an accurate impression pretty much every time. The downside to them is, one, hydrophilic materials have a tendency to attract moisture. So the longer they sit, the more distorted they get. So once you take an impression, and say it's just a simple little crown, they're really great because you'll take a good impression, send it off to the lab. The problem is if it sits at the lab for a couple of weeks, it may not come back as accurate as it should have been, okay? Because it sat for too long. The other problem with polyethers is their tear strength. They didn't. Whenever you did like an undercut on the prep, or you do an implant case, or something where it's a little more complex, or a full mouth restoration, you pull that out. Sometimes there's a tendency that you can't get it out. If you pull it out the wrong way, or not too hard, or whatever, sometimes they'll have a tear. And when you get a tear in your impression, you're basically done. You got to start over. Polyethers also too had. They're still popular today. You'll see a lot of doctors still use them, but they taste horrible. Patients don't like them. Nothing really minister tastes good, but those taste particularly wrong. And then also too, they're pretty runny. So sometimes they'll run down if you eat too much. They'll run down the patient's throat and they'll gag. So polyethers, even though they're still popular today because of their accuracy, there's better things that have come out. The next impression material that came out that was the next advance from that was your BPS material, or your PBS or BBS, polyvinyl siloxane. So what those, and that's pretty much what you're going to see most of today. And polyvinyls were great because they gave you an accurate impression, but had really high tear strength. And then you could use them too in different ways. You could use them in a two-step technique or a one-step technique, which we'll talk about. But they gave you all the benefits of a polyether, but not all the disadvantages. So you got the increase in tear strength. The downside to polyvinyl siloxanes, which is they're a silicone material, they don't absorb moisture, so they're hydrophobic. That's right. They don't like moisture, right? So it's a rubber material. So like your tires on your car, right? You're driving down the street, and it's rainy. You got channels in your tire, and you drive across the rainy road, right? Why do you not slip? Because it's channeling the water. It's pushing that water out of the way, so you get a dry surface. And that's what polyvinyl siloxanes do. When you have to dry that field, you have to put retraction cord in, you have to keep it nice and dry so that when you do go in for your impression, there's no moisture there and you get a really good, accurate impression. So that's the disadvantage to a polyvinyl. But today, most offices have used a polyvinyl or use polyvinyls in place of the polyvinyl. GC has a product out that's come out recently, or it's been out for a while now. It's actually a combination of the two. It's called a VPES material. They took polyether, they took polyvinyls, and mixed them together and gave you a system that is hydrophilic but stable, and gives you the accuracy that you're looking for. Okay, so that's the latest from GC. But our main product that we sell, and most dental manufacturers sell these days, are the polyvinyls. Those are the biggest ones. Okay. So what we're going to do is we're going to go through a couple of things with the products. This actually happens to be our VPES material called Excellent. The reason I use it in this presentation is because it just goes through a lot of information. And so you can disregard really what the product is at this point. It's more or less just trying to get you to understand kind of how we take good impressions. So, can you see that? Okay, so how do we really take a good impression? It's important that material selection we've gone over, it really doesn't matter these days. It's really all about doctor preference, but each one has its own advantages and disadvantages. I'll tell you right now that 95 to 99% of the problems that you have with impression material taking has to do with the tray. Everybody knows what I mean when I talk about a tray, right? The actual the tray that you put the material in, it's got to fit the patient's mouth the right way. You have to have enough space laterally, right? And you also have to have enough material in the tray to be able to capture an accurate impression. So, like I said, most of the problems are with the right size tray. So you take a tray, you put it in the mouth. If it's too big, you always want to go one size bigger. If you think bigger than what you think you need, if it's too big, you go down a size. That's really the best way to be able to check and see if you have a tray. You don't want a too small a tray. If you do too small a tray, then you get all sorts of different problems. Anytime you go through the material and hit the tray, it's going to distort, obviously, the final restoration. So we want to capture enough of the tooth surfaces and the opposing arches and all that kind of stuff to be able to get an accurate impression. And the only way we can do that is with the proper tray. Okay? So, material selection, tray selection. Don't worry about tissue management and tooth preparation. The doctor pretty much takes care of that. We'll go over a little bit of that. Traction cord, we'll talk about techniques on that. You know, where would we use a retraction cord or hemostasis? What type of material would we use that with? We'll use it with a polyether, or we'll use it with a polyvinyl? Polyether. So polyethers never have a tendency to retract moisture, so they're going to absorb moisture. So it's not as critical as it is with the polyvinyls. Okay? So we'll talk about retraction cord, hemostasis, different impression techniques. We'll go over that. And then, you guys do bite registration, Dr. Sete?
Yes.
Okay. we'll go over that. All right, moving on. You don't really need to worry too much about the selection of material. That's really about what feels good in your hands, what the doctor really likes. Like I said, you're going to run into both. You're going to run into polyvinyls, and you're going to run into polyether. And you also run into alginate. One thing you never really want to do is for a final restoration is do an alginate for a final restoration. You're really only going to do polyethers and polyvinyls for final restoration. Okay. Shrink it down. Apologize for that. Okay, so tray selection. There's several different types of trays that you're going to run into. I've got some examples of some here today. The least expensive way is to go with like a plastic or a triple tray. The advantage to using something like this is it's just relatively inexpensive. You use it one time and then you send it off to the lab where you disinfect it and it's thrown away when the case is finished. These plastic trays that's really the only advantage to them. They have a tendency to be a little inaccurate because if they're not rigid, they'll move on you. So it's better if you put it in the patient's mouth and it's not the right size and you kind of force fit it in there. It'll distort the impression. They'll take it out, and when you get your final restoration back, it won't be correct. So if you use them properly, they're good because they're inexpensive. And you can use them for the plastic type trays for whether anterior, posterior, or the triple trays. You can use them for single units. You can use them for making temporization and temporaries, or you can use it for making custom trays, bleaching trays, things like that. But when it comes down to your final restorations, what we recommend are either the hard, rigid plastic trays or your perforated stainless steel trays. The advantage to using a perforated stainless steel tray is that when you take that impression, all that material actually will go down into those. You can't see it on here, but they'll go in there's little holes in it, and they'll go down and they'll grab the material because we don't want the material to delaminate from the actual tray. And they don't move at all, so you get a nice, solid base for your restoration, and they give you a really accurate impression. And they're also reusable, right? So you just autoclave. When you're done with it, you clean them out, you autoclave them, and then you reuse it for the next patient. Okay? So doctors will have a tendency to buy a whole set of those and then keep them for years. You can also then go, again, there's the full plastic trays, which are same concept, same idea as the stainless steel, but they're disposable. We have different types. We've got full arch trays. We've got quadrant trays. These are examples of full arch trays. This is a stainless steel non-perforated tray. When you're using something like this, if it's not perforated, where there's holes in it, where the material can go down and kind of grab and seat itself, you have to use some sort of tray adhesive. So you paint an adhesive on there, fill your material up, and then you go ahead and seat the impression. And then there's your adhesive. Okay, so now you've got your material, you've got your tray selection, and everything's ready to go, and now we got to deal with moisture, right? So if we're talking about whether it's polyether or polyvinyl, you still have to have some sort of moisture control. The more moisture control you have, the better your impressions are going to be. So when we're talking, let's just talk now about polyvinyl siloxanes. Your polyvinyls, you want to be able to control bleeding and also moisture. So the way that doctors do that is after they do the prep, and they take retraction cord and they pack in that retraction cord. Now the retraction cord does two things. One, it pulls the gum tissue away from the prep, so the actual material can go down into around the prep. Okay. Here's your tooth. Here's your gum. You've done all the prep. They want to be able to capture this margin. Why would they want to capture this margin right here?
And they seat the tube, make it more natural looking.
Right, exactly. So you don't want a gap when you get your crown. You don't want your crown to sit up here. Right? You want your crown to go all the way down and blend in right with that. We want to minimize the amount of cement that we have to use for this as much as possible. Right? So we can actually seat this. Technically, if you do it correctly, and correct me if I'm wrong, is if you do a really perfect prep with a nice, perfect restoration, you can seat that on there and it'll seat in. You can pretty much cement it with just about anything. Right?
And
it'll
you
stay
will
on.
last a long time.
And it'll last a long time. When you get into problems with dentistry is when that's not accurate, you know, the crown doesn't fit right, the doctor's sitting there for 45 minutes trying to adjust it and everything. Well, that has a tendency to go back to what we really originally talked about, is getting an accurate impression. Somewhere along the line between the impression material and the lab, something got distorted, right? The lab blames doctor blames lab, right? But the reality is that if we take a really good, accurate impression, all those pretty much go away, okay? So what we want to do is, doctors will have a tendency to pack cord. There's different types of hemostasis and retraction system, but for cord, they're gonna pack some cord down in there. You can do a single cord pack process, and that cord is going to do two things. One, it's going to pull that gum line away from the restoration, so you can actually, from the prep, so you can actually get an accurate impression. And two, with the double cord systems, or either cord system, I guess, they'll also have a hemostasis or a hemostatic product in there. And everybody knows what I mean when I say hemostatic, correct? Hemo is what? Blood. Okay, so we want to be able to control the bleeding. So they have a material in them, usually like a ferric sulfate or something that actually will inhibit the bleeding process, right? Okay. Is that going to be on the test? Hemostasis?
Yes.
Question? Okay, so the purpose of a cord is to, one, pull the gum tissue away, and two, if it has a hemostatic in it, it's going to stop the bleeding so you can get an accurate impression. Okay. There's also, instead of cord, you can go to retraction chemicals. I'm not too familiar with these, but just because I think we don't really carry anything like that. But epinephrine is one of them. And I think what happens is you take the chemical and you inject it around the prep, and chemically it stops the bleeding. And I think they actually now incorporate this where it actually will allow the gum tissue to kind of pull back temporarily and recede. Is that correct? Is that like Arrestin? And
Well, no, not arrested.
not Arrestin, I mean, what's the word? I can't remember.
It's something stat. Something
Yeah,
stat.
yeah.
You inject it, and it's kind of like a foam, and you inject it in there, and it kind of swells up and compresses the gum tissue, and it's got either epinephrine or another solution. It just stops the bleeding, and then
Sure.
you just rinse it out.
Yeah, like an astringent.
Then it's
Yeah,
astringent.
yeah.
That's-
So, so there's those two types of systems which you might see. You might see the retraction cord or the actual chemical. Right? One thing with the retraction cord, it does have an astringent in it, meaning aluminum sulfate, aluminum chloride, or ferric sulfate. They have a tendency, you'll see them, they'll be kind of bluish in color. So you'll see the cord, and you'll see kind of blue stuff kind of around the prep and around, you know, the actual instrumentation. And the advantage to that is it'll help to stop the bleeding and pull the gum tissue away. The disadvantage to them is now you've got a chemical residue around that prep, so you have to remove that. And the reason we remove that is because it can interfere with the impression material and setting. Okay, so one of the things we'll talk about when you're choosing an impression material is setting time and working time. Okay. The working time is when you actually fill the tray, how much time that you have from filling the tray to actually getting into the patient's mouth. That's your working time. Once you put it in the mouth and you seat it, that's your setting time. Okay. So there's usually a regular set, which is usually right around 4 minutes, and then there's fast set, and those vary from manufacturer to manufacturer. Ours are about 90 seconds in the mouth. That's usually about right, anywhere from a minute to 2 minutes, depending on the manufacturer. Okay? So you're going from basically a 4-minute to a fast set, which would be like a minute and a half, 2 minutes. Why would we pick a fast set versus a regular set?
Same time.
Save time. It's a good one too. What would be the disadvantage of using a fast set?
Set on you.
It's going to sit on you, right? So let's say that I've got one of these. Go back here. Let's say we got this full stainless steel impression material tray here, and you've got a gun. Where's my dispenser? Let me get a dispenser. There you go. We put our impression material in here, close it, and then we go ahead and start filling our tray, right? And I'm doing this. If I'm using a fast set and I finally get that tray completely filled, by the time I finish at one end, the other side's already set, right? So you got to be careful with that, especially when you're doing full arch. Fast sets are good if you've got impression material dispensing systems. So you've got these machines that sit out and you can put them in full cartridge and it dispenses out really fast. You can fill a tray and go right in.
Yeah, his fun stuff is right
Yeah, so we have impression material dispensing type machines, or we have the traditional, cartridge type systems. Okay. So fast sets are generally good for smaller cases, regular sets for bigger cases. If I'm going to do a full arch impression, I probably want to use a regular set. It gives me enough working time. If I'm doing a small little quadrant where I'm just doing one single unit crown, I can get away with using, say, like a triple tray where I get the bite registration and the actual impression at the same time. Fast set's fine because you just fill it up and seed it. Okay. The reason I went into that is because these astringents, if they're not completely wiped away, rinsed away, have a tendency, they can, one of their disadvantages is to affect the setting time. Okay, so you'll go in, we'll talk about a single step and a two-step technique. A two-step technique is where you fill the tray and then you have a lighter material, you have a heavy body material on the tray and a light body material, and if the doctor's going to inject around the prep. I'll show you that. So they'll inject that around the prep, and you hand the tray to the doctor seats it, you wait 2 minutes to 4 minutes depending on the setting time, you pull it out, and everything's set except for the light body, the wash material, the lighter material. It's not set around the prep. Well, something interfered with that. What was it? Typically, it's like eugenol or latex sometimes has an effect on that, or maybe the astringent wasn't completely pulled out. So if you see that, 99% of the time something affected it. 1% of the time it's a defective product. Okay? Everybody's good with the difference between working time and setting time? Okay. Okay. Moving on. Okay, so different techniques. What kind of different impression material techniques are going to be out there that you're going to see? There's a single mix technique. There's different viscosities of materials. Okay, so there's going to be a light material, or we call it a light body material, or a wash material, and then you're going to move into, and it's typically what they're going to do to capture around the prep. So the theory is that we take a really heavy, thick material in the tray, or we call it the tray material, and a light material around the prep. So then when we marry the two together, they kind of just smash the heavy body. The tray holds it. The heavy body material pushes that light material into all the detail, and we capture all the detail. Okay, so that would be a two-step technique. So there's a light body material or a wash material. Then there's what we call a medium body or a monophase material, which would be a little bit thicker. And then you've got a heavy body material, and then you typically have some type of putty material. And I have a putty material. We'll actually be able to play with that a little bit. In the single mix technique, this is really designed around materials like what we would call like monophase. So mono meaning one, phase meaning type of material. Right? So we have one type of material, which would be your medium body or monophase. The Ipergum, or the polyether that we talked about earlier, that was hydrophilic material that would tear air easily. It was really kind of idiot-proof. You could take an impression in any underwater if you want, right, and still get an accurate impression. Those were typically monophase. What they would do is they would fill the tray with one material and then take that same material and inject it around the tooth. And then they would seed it, okay? So what they're doing is they're trying to capture the detail with injecting around. That's your single-step technique. That would be your monophase material in a PVS material, polyvinyl siloxane, or in like an Infragum type material, or a poly. That's your single step. And here's an example of it. Anybody see that? So the tray, this actually happens to be, I believe, Infragum. So you fill it, you inject around with the same material, you marry the two, and then you get that result. Okay. Everybody see that? Okay. Get it? One phase. So it's going to be your single step.
So what's injected into the tooth and what's in the tray is actually the same material, whereas what we use is two different materials.
Right. Okay. So there's your single technique. Any questions about that? All right. Double mix technique, or what we call a two-step technique. This is what we would talk about earlier, where you would take a heavy body material, so it's thicker, more viscous than your monophase or your single step. You fill that material in the tray, and then you take a lighter material and you inject around the prep, and that lighter material then gets into all the nooks and crannies. The reason that we can do a single step with the monophase or the Infragum was because it had a tendency to attract moisture. So if there was a little bit of blood or a little bit of saliva or a little bit of water in there somewhere, that would absorb into that material and would be wouldn't affect the impression. Okay. With the double mix techniques, which is really designed around the polyvinyl siloxanes, or the rubber material, right? Is that like that wheel on the road, that tire on the road, it's pushing the water out of the way. So we want that light body to get in there, and then we want the heavy body to push all that water out. They talk about contact angles and all this other stuff, but really, and they talk about polyvinyls being somewhat hydrophilic. They're really not. They're really all designed around what they're talking about is pushing that. How well does that material actually push the moisture out of the way? Okay? And that's what this two-step technique is really designed to do. Okay? So, same concept. We're going to fill our tray. We're going to take the light body material, which is typically a different colored material, right? It's different because doctors want to be able to see a contrast between the two, so you can capture that margin, you can see it. And we can do one of two things. We can use a really light body material, or kind of what we consider, or a light material, or we have a product called injection. It's just a little bit thinner. So, and why I use one or the other, it's just doctor preference, that's all. Okay? They can choose what they want. Some doctors like to have the really thin flowing material, and some like a little bit thicker. But either way, you get the same result. You get a two-step system. Okay. So single step versus two-step. How do you know it's two-step? They're usually different colors. Any questions about that? Okay, then there's also a product called putty. Typically putty comes in a hand mixed material. It's much thicker. That's right. It's like making Play-Doh. You take two Play-Doh materials, you mix them together. We'll have some in here. We'll play with it. And you just mix it together till it's all the same uniform in color. You'll have a blue or green and a white. You mix them together, and then it turns into one color. Then you're ready to go. The advantage to using that is it's super thick. It's really accurate material. The disadvantage is in most cases you have to hand mix it. There is one company out there that actually does put a putty in the machine, believe it or not. DMG makes one. St. Louis make Fluxitem. It's a really good material. So the putty wash technique is essentially the same thing as the two-step technique, which is you're going to, instead of taking a gun dispenser type system and dispensing that into a tray, you're going to take two balls, mix them together, and then stick them in a tray. Okay? Stick them in a tray, you mix it, place it, and then typically what you can do at this point, you can either take your finger and make a little well inside there, and you can fill that tray material with the heavy body material with your light, and then seed it. This is a technique that they use quite a bit with Invisalign. For your Invisalign process, they're going to try and use a putty material, hand mix it, put it in their special tray that they have, make a little well, fill it with your light body, and then seed it. Okay. Why do that technique with like an Invisalign? Well, you're not really trying to capture one individual tooth, you're trying to capture them all. And the thing with Invisalign is you got to make sure that you really get those posterior molars, so there's something they can grab onto so they can make their adjustments. That's why they like that two-step putty technique. This particular one, they did that, they filled it, and captured it that way. You can also do a putty and then inject it around the tooth if you're just going to do a prep, right? Use a putty first. Okay. I don't think I'll go over disinfecting. Typically, you disinfect your trays, right? You disinfect your impressions once you take your impression before you send it off to the lab. It's full of all sorts of nice things, and you want to get those out, right? So you disinfect it. So if you're going to put those into a disinfectant, polyethers have a tendency to what? Absorb moisture, right? So you got to be a little careful with that, making sure that you don't distort your impression. But polyvinyls, you don't have to worry about that. Okay. Anything else here? Troubleshooting. I'll kind of go over this pretty quick. Like I said, 95 to 99% of your problems have to do with the tray selection. If your technique is right on your impressions, you shouldn't have any issues really at all, unless it's a manufacturing defect, which is usually pretty rare, but they do happen. Tears, you get these tears typically with materials when you have like implant dentistry, right, where there's a lot of undercuts and things like that, and you're capturing a lot of detail, and the material kind of flows underneath something, and you got to pull it out. So a lot of the materials these days have really super high tear strength, so you don't have to worry about that too much. Some of the inferior products on the market will have a tendency to do that, or if it's got a material like a polyether, they'll tear. Okay, if they tear, then you just have to retake it again. We talked about this earlier. If you don't have a material that actually is sticking to the tray, if you don't have perforations in your tray, or you don't use a tray adhesive, sometimes when you pull that tray out of the mount, it'll delaminate and pull away from your tray. Okay, so that's what that's talking about here. So the problem is the solution is basically use a tray adhesive or a different tray that's got perforation. Voids and bubbles. What would that be caused by? It can be caused by the material. Sometimes if there's voids or bubbles in it, but typically there's some sort of moisture or contamination in there. And what would be the problem with having an impression material that's got voids in it or bubbles?
Well, because when a bubble is surface like that, it can distort whatever you're trying to make. So, I mean,
Exactly.
you have to retake it.
Yeah. So you get your crown back with a little
Bubble.
nub on it.
Yeah.
Right? So labs don't like that. Here you go, tooth contacting the tray. This is a what? Tray selection problem, most likely, because you couldn't get enough material in there, or you didn't fill the tray enough. Maybe you got the right tray, but you didn't fill it enough. Maybe the tray's too small. What's a good way to select a tray? Remember? Go one size bigger than you think, right? And then go down. Pulls and drags. This is a problem when you use two incompatible materials. I would suggest, I get this question from doctors all the time, can I use my light body with your heavy body material? Sure, you can, but and they may work for you, but they may not. The reason for that is that they're all designed to work as a system. The biggest challenge with that is that if I have a regular setting material, and then your wash is a fast set material, one setting before the other, you're going to get delamination. The two materials will go apart. So in general, you should use, if you're going to buy one impression material system,
You should buy the
just
same.
buy the whole system, right? Don't really mix it in. You can get away with it, but it's not ideal. Non-setting, non-setting material, if you put the wash, or typically it's the wash that doesn't set, you've got some kind of contamination from the chemicals that you used, or pulled it out too early, right? You didn't let it set.
Or they didn't purge it.
Yeah, they didn't purge it too. That's another thing too. Every time you get, we'll go over this too when we're doing our demos. When you get a new cartridge, you place it in here, take the tip off, or the little
Cap.
cap. Whatever. So you take the cap off. You want to bleed a little bit out first, and the reason for that is just to make sure that both the base and the catalyst are coming out evenly at the same time. Okay. And we'll talk about troubleshooting that when we get out there. It's easier for me to show it visually. Dimensional changes. This really isn't too much of a problem if you're using the right setting material, and don't use a regular set until you use a fast set and pull it out, right, when you'll get distortion. That's really what this is, a pull or a drag. Basically, they pulled it out too quickly. Distorted crowns, kind of the same thing. Tight fitting crown. Again, tray selection. More voids. Okay. So that's pretty much it. The only other thing that we need to address is byte registration. So the other thing that you're going to run into along with impression material taking is you're going to do byte registration. And what I mean by that is you're going to try and register the byte. So if I've got a tray, I'm going to do a full arch tray or a quadrant tray, and I don't have the ability to see the opposing arch, I need to capture that. Why would that be important? I think it's important that I capture the opposing side to the tooth you're prepping.
I mean, so you know how big to make it, so that it'll look small.
Right, everybody do this.
Yeah.
Right, your teeth fit together, right?
Yeah.
So if I don't have that, if I've got the cusp in the wrong place, or I don't take that and I don't capture the other side, I don't know how your teeth fit together.
You can end up clashing.
Yeah, you're gonna, if I have like a
Break that
zirconia,
crack.
let's say I put a zirconia crown in, zirconia is super hard. I mean, it's harder than your tooth, like 10 times harder than your tooth structure. It's ridiculously hard. So what's gonna break first, the zirconia or your tooth? Your tooth, right? So, there's a test it's called like the popcorn kernel test, right? They basically put a popcorn kernel and they bite down on it and it'll break one or the other. But that's essentially what happens. So if you don't have the accurate bite registration on the other side, your teeth aren't going to be in occlusion, and you're not going to get an accurate, or you're going to have problems. The patient's going to have problems. Okay? You could break the other tooth. So that's why we take the opposing arch or the bite registration, so that we can actually teeth fit together. We can do that with a triple tray. I'll show you an example of a triple tray, which is it's triple function. It's got three things that it does. One, it captures the margin, captures the opposing arch, and it captures the occlusion. Okay? Those are the three things, right? Yeah. So you can do those on like single unit crowns, and I think you guys will be using those, right? Yeah.
Yep.
So you'll see the triple trays. Okay, that's it. Any questions?